Assalamualaikum and a very good morning. So today I will be presenting regarding illnesses and social issues, dementia, and will be focusing only on Alzheimer's disease. So what is dementia? Dementia is a progressive degenerative brain dysfunction including deterioration in memory, concentration, language skills, visual spatial skills, reasoning that interferes with a person's daily life. So unpredictable changes in personality can also occur. Dementia is considered a late life disorder because it develops most frequently in the elderly. And dementia is not actually a disease itself. It is a group of symptoms that are caused by other conditions. Dementia can be caused by substance abuse, hypothyroidism, vitamin deficiency, head injury, Parkinson's disease, and many other disorders. Some causes such as vitamin deficiency can be treated and cured. However, only about 20% of dementia is treatable, and in most cases, dementia cannot be cured. So, dementia consists of 4 types, which are vascular dementia, frontotemporal degeneration, Alzheimer's disease, and Lewy body dementia. And today we'll be only focusing on dementia disease. Alzheimer's disease. So Alzheimer's disease accounts for 60% to 80% of the cases of dementia, which is very large. And it's common cases. Okay, so what is hallmark pathologic characteristic? So it started with amyloid plaques in the space between the neurons, abnormal deposits of a protein fragment called beta amyloid, which is formed from the breakdown of a larger protein called amyloid precursor protein, and then neurofibrillary tangles inside the neurons, then abnormal cluster of protein called tau is formed and causing loss of synaptic connections between neurons and cell death causing brain atrophy. Okay, so the risk factor of dementia is mainly is including age, family history, genetic disorders, history of head trauma, vascular disease, and certain types of brain infections. And there are 3 stages of Alzheimer's disease, which are mild, moderate, and severe. For mild stage, the person will be going through memory loss, getting lost in familiar places, having more difficulty doing normal daily tasks, difficulty with managing finances, making bad decisions, not being as talkative or verbally fluent, and being more moody or anxious. While for moderate stage, the person will going through increased memory loss and confusion, short attention span, difficulty with language and numbers, difficulty with reasoning, inability to learn new things or to adapt to new situations, restlessness, agitation, anxiety, tearfulness, and wandering, especially in late afternoon or at night, repetitive statements, questions or movements, hallucinations, delusions, paranoid, irritability, and impulsively saying or doing things he or she normally would not. While for severe stage, the person will going through weight loss, seizures in some patients, dysphagia, vocalization, but speech usually unintelligible, increase in time spent sleeping, bowel bladder incontinence, loss of recognition of family, pressure ulcers, and neuromuscular symptoms. Effect of aging on dementia. Does dementia normal for aging? For me, although dementia is much more common in older adults than in younger person, it is considered not normal part of aging. Forgetfulness is a common complaint among many of us as we are getting older. Memory lapses can be frustrating, but most of the time they aren't cause for concern. Age-related memory changes are not the same thing as dementia. As we grow older, we are not as quick as we used to be. In fact, we often mistake the slowing of our mental processes for true memory loss, but in most cases, it If we give ourselves time, the information will come to mind. So moving to health promotion on dementia for older adults. So what can be done to prevent to get dementia? So first of all, we should get physically active. Physical activity is very important for brain health. Every adult should aim to include 150 minutes of physical activity in their week. You can try taking a brisk walk for 30 minutes at least 5 days of the week. Second, keep your brain active. Everyday activities such as going to work, reading, playing cards, or a musical instrument all keep your brain active. These activities should be a bit challenging but still enjoyable. Third, stay social. Join a friend for a walk, go dancing with your partner, continue attending your local sport club or any other activities with other people. Maintaining social connections and activity is essential to living well with dementia. The fourth, quit smoking. It is hard to quit smoking, but it can be done. It's one way to maintain a healthy body and mind. You can get help from Klinik Berhenti Merokok. Fifth, maintain blood pressure. Healthy pressure is important not just for your heart but also for your brain health. You can get your blood pressure checked out each time you visit your doctor or at least once every 6 months. For the last one, healthy eating. Healthy eating well is important for everybody in every brain. A balanced diet that is rich in vegetables, fruit, whole grains, dairy, lean meats, poultry, and fish is a good starting point. Eating the healthy food combined with reducing alcohol consumption are good ways to maintain physical and brain health. Okay, moving to general nursing consideration for dementia. Okay, first of all, we need to maximize safety by modifying the environment to compensate for cognitive losses. Control any factors that increase stress, such as fatigue, physical stress, competing or overwhelming stimuli, changes in routine, caregiver or environment, or activities or demands that exceed the person's functional ability. You can also plan and maintain a consistent routine, implement regular rest period to compensate for fatigue and loss of reserve energy, and can also provide positive thinking unconditionally. Next, you can remain non-judgmental about the appropriateness of all behaviors, except those that present threats to safety. Recognize individuals' expression of fatigue, anxiety, and increasing stress and intervene to reduce stress as soon as possible. Use reassuring forms of therapy such as music and reminiscence. For the next one, non-verbal communication. You can attract and maintain person's attention through eye contact, pleasant facial expression. You can use a relaxed and smile approach. And then you can also reinforce with verbal communication with appropriate non-verbal communication, such as demonstrate what you're asking the person to do. You can also use simple picture rather than written cues because it is more easier and simple. And then use therapeutic communication to gain person attention, reinforce person's feeling of concerns. Next, verbal communication. You can simplify sentences according to person's ability to process information. Present only one idea at a time. Allow enough time for the person to process the information. Do not argue with the person unless it is a matter of safety. Avoid complex humor or sarcastic humor as it can hurt their feelings. Moving to ensuring safe of the procedure. So, for general environment modification, we can modify the environment to compensate as much as possible for sensory deficits and other functional impairment, such as use clocks, calendars, daily newspaper, and simple written cues for orientation. Use simple pictures for identifying places. You can also use written cues or color codes to identify color or places. Place pictures of familiar people in highly visible places, but don't use non-glossy picture and non-black glass in picture frame. Okay. You can also turn light on as soon as or before it get dark. Use nightlight or leave dim lights on during the night. Provide adequate environmental stimuli while avoiding overstimulation. Technique to ensure safety. Make sure the person carries some form of identification along with the phone number or some to call. Modify the environment for safety. For example, you can use alarm device on doors to prevent wandering. Keeps environment tidy, and then you can keep medication, cleaning solutions, and any poisonous chemical in unreachable places. Next, a technique to facilitate ADL, activity daily living. For this one, you have to keep all activities as simple as and routine as possible. You can establish routine that allow for maximum independence and the least amount of frustration. You can for example, you can lay out one set of clothing in the order in which the items are to be done. Leave a toothbrush on the bathroom sink with toothpaste already on it, and many more. Um, you can modify it according to the person needs. Okay, so that's all from me. Thank you for listening, and thank you. Assalamualaikum.